Hi there, and welcome. I'm so glad you're here. We're going to talk about something really personal today, something so important, our journey to pelvic wellness. It's a path that asks for a lot of patience and a real understanding of our own bodies. My hope is we can just walk through it together with a bit more clarity and a whole lot of kindness. All right, let's just get right to it, shall we? To the one question that is probably screaming in your mind right now because it feels so urgent. How long is this going to take, right? It's the first thing we all want to know when we start down this path. I know I did. And listen, I need you to hear this right from the get-go. If you've ever felt that impatience, that little knot of worry about your progress, you are so not alone. It is 100% normal. It's basically part of the journey for almost everyone. So, to help us make sense of all this, to navigate all the ups and downs, we're going to lean on the wisdom of a really wonderful guide. I'm talking about Dr. Farzana Khan from the Women's Health Clinic. Helping women through this exact process, well, that's her life's work. Dr. Farzana's whole approach, it's really built on trust, on care. It's all about making sure you get clear explanations, so you're never left wondering what's going on. And more than that, it's about making you a partner in your own healthcare. Because at the end of the day, it's your body, and it's your journey. And she really knows her stuff. We're talking over 20 years of medical experience here. She started with her medical degree in Copenhagen and then specialized in sexual and reproductive health. So, you see, her focus has always been on our intimate wellness. And get this, she doesn't just practice. She's so respected that she actually trains other doctors. That just tells you everything you need to know about her commitment, right? Okay, so let's dig into the why. Why does it take the time it takes? To really get it, we have to look at our own biology, which is, both beautiful and super complex. And this is where we're going to see that patience, it's not just a nice idea, it's actually your secret weapon. This is the key. Healing is never, ever a straight line. Nope, it has zigs and zags. Our bodies have their own internal clock, their own pace for getting things done, and there's one fundamental truth we just can't get around. You can't rush biology. Okay, this next part is, honestly, it's fascinating. Check out this timeline. For the first 4 weeks, you're not even building muscle? Can you believe that? That's what's called neural adaptation. It's basically your brain just trying to find the phone number for your pelvic floor muscles again. It's all about reconnecting the wires. The real muscle building, that doesn't even start until about week 8. And then making that strength feel automatic, well, that can take months. And oh my gosh, this is such a common frustration, isn't it? That feeling of, I tried physio for a whole month and it didn't work. But here's the truth, the real reality check. That 1 month wasn't a failed trial, it was just an incomplete one. You were still in phase 1, doing that super important work of building the brain-body connection. You were actually succeeding, even if it didn't feel like it yet. Okay, let's switch gears for a second and talk about nerves, because they're a huge piece of the puzzle for a lot of us with pelvic pain. And here's the thing about nerves. Our bodies have a very strict speed limit for how fast they can heal. And that speed limit, it's tiny, just 1 millimeter a day. So let's pause and think about that for a sec. 1 millimeter a day, that's roughly an inch a month. So if you have a nerve that's been irritated deep inside your pelvis, you can see how it could easily, naturally take 6, even 12 months to heal fully. That's not a failure. That is your body doing amazing microscopic work at its own unrushable pace. It really calls for us to be incredibly gentle with ourselves. Okay, so that's the science, the biology of it all. But what about you? Now we've got to make this personal, because it is so important to remember and to honor that your timeline is going to be completely 100% your own. So maybe we can just take a moment and ask ourselves, what makes my healing timeline unique to me? Because when we start to understand those pieces, it can really help us let go of that pressure, the pressure to compare our story to someone else's. I mean, think about it. So many things play into this. How long have you had your symptoms? The longer it's been going on, the more ingrained that pattern is in your nervous system. What about your home practice? Are you able to be consistent? And your hormones, where are you at with that? Menopause, breastfeeding, those things can affect how tissues heal. And of course, big ones like stress and anxiety and any other health stuff you've got going on. It all comes together to create your unique picture. All right, so knowing all this, what do we do? How do we move forward? Well, the good news is the path forward isn't about pushing or forcing, not at all. It's about finding gentle, supportive ways to work with our bodies. And there are things you can do every single day to be an active part of your own healing. Think of them like little gifts to your body. Like just taking 5 minutes for some deep belly breathing, that can do wonders to calm down your pelvic floor. Or just paying attention to how you're sitting, drinking enough water, and using a stool so you're not straining. These things seem so small, right? But believe me, they add up to make a huge, huge difference. And please, please remember, you are not in this alone. Your healthcare team has a whole toolkit to support you. There's stuff like biofeedback to help you actually feel those muscles working. There might be things like topical estrogen to help the tissues, or you might work with a whole team of people for pain management. The point is, there are options to build a plan that's just right for you. Which brings us right back to where we started, to the heart of what Dr. Farzana believes in. And this is what every single one of us deserves: clear explanations, realistic expectations, and a real partnership where you feel heard and you are at the absolute center of every decision. So I want to leave you with a question. For just a minute, let's forget about how long. Let's bring it right back to this moment, to right now. What is one tiny, gentle, kind thing you can do for yourself on your healing path today? Just one thing. Because this whole journey, it's not really about some far-off finish line. It's about all the small, supportive steps we take for ourselves along the way.